So I'd like to welcome up on stage a panel which is made up of some fantastic speakers, actually. We have Paresh Parasnis from Piramal, we have Xerxes Sidwaf of USAID, Neera Nundy of DASRA, and moderating will be Rohit Menendez of the Bridgespan Group. Welcome.
Clear. Namaste, everybody. Thank you so much for actively participating in the day-to-day. And I really shouldn't lose the opportunity. I think I'm going in and out.
Yeah.
Why don't you just switch it off? I'll use one of the microphones here. Will do. All right, let's try this. Now it's on. Let's try that again. Good morning, everybody. Namaste and welcome. We're absolutely delighted to actually today, after a whole morning of talking about collaboration, to showcase an actual collaboration in India on the very topic that's been the thread throughout the day, which is adolescent girl empowerment. And so we have three illustrious people here on the panel, and we're going to go through their experiences working on the DASRA Girl Alliance, which is a very important and interesting alliance here in India. Before we start, I should say thank you, like everyone else has, to DASRA for getting together this incredible room, and the rooms that have preceded it this week and the years past, and the many years, I'm sure, in the future. DASRA is such a unique intermediary organization in the world, and I think Deval and Neera and their amazing team should really be congratulated every chance we get. So we're going to do three things today, really. We're going to tell you a little bit about the DASRA Girl Alliance. Actually, they're going to tell you a little bit about the DASRA Girl Alliance. And then we're going to talk a little bit about emerging research about adolescent girl empowerment in India. Research that my organization, Bridgespan, has had the privilege of doing in partnership with Neera, and another member of the Girl Alliance is not here today, the Kiowa Trust. And then we're going to talk a little bit about the implications of their experience on private philanthropy and how collaboration works in private philanthropy, something I think that's really relevant to the audience in the context today. So to start off with, many of you are familiar with the Girl Alliance, but many of you are not. Many of you are for the first time in a room like this. So I thought we'd start by just giving a basic description, have Neera actually give a basic description of the Girl Alliance, and talk a little bit about the accomplishments of the Girl Alliance to date.
Sure. I'm assuming this will go on at some point. Thank you, Rohit, and thank you, everyone. Often this becomes a DASRA love fest, and as much as I love it, it is quite embarrassing, but thank you all. So the point of our conversation is really to help us think about opportunities to collaborate. And so I thought I'd talk a bit about the DASRA Girls Alliance as one way that collaboration can happen. And maybe it's helpful if we think about the journey, because I'd be lying to say that it's completely straightforward and all of us sitting on this stage all aligned immediately and we had this grand plan to do where we are right now. And so where we started really was very simple, and I'm going to try to give two sides because Lynn Smitham and Peter Smitham of the Kiowa Trust weren't able to be here, and they're based in London. They're the family foundation and the private family foundation that is one of the key pieces to the Girls Alliance. And when we started with them, we really just were leveraging the way that DASRA is structured. And I know we don't spend a lot of time speaking about what DASRA is like, but I think it's useful just to give a bit of a background on the kind of work we do, because it's really this alliance that has allowed us to also grow. And so when we started working with the Kiowa Trust, they really just said, hey, can you give us some research? We're thinking about funding adolescent girls in these sort of high prevalence states. Give us a sense of what it looks like and where would funding make a difference. and really started down this path with how Dasra is structured. So we have sort of knowledge and creation, and that's the whole team around which we do a lot of our research and our due diligence, and you'll see research on your tables. Then the other piece is capacity building, which is really around how do we help NGOs scale on the ground, providing them management support, and on the other side, how do we work with philanthropists and corporate so that their giving can be more strategic. And then sort of the third pillar is really around fundraising, where how do we help raise funds from corporates, how do we work with philanthropists to raise funds and connect it to the organizations. And the last piece, not because it comes last in priority, but really is around collaboration. And so when we started with the Kiowa Trust and we started with a report, it was really just the idea that it would end in a giving circle. And at that time, which was about 3 years ago, we were just really excited that we could raise around $1 million through a giving circle. And they weren't even totally bought into the giving circle. They were like, let's just do the research. And so about 3 years ago, we literally had to piecemeal things together. Somebody would pay us for research, then we'd be able to raise some money for the capacity building, then we would go and do giving circle members. It's really after we did this full piece together that when we approached USAID and spoke to them about the opportunity that we were looking at adolescent girls and its real, critical link to health, was the point where we realized, wait a second, there's an opportunity here to build a platform, for lack of a better word, not a digital platform, like a platform that different people, individuals, and stakeholders can start to participate in to really start to address the different issues around which you need to work towards so that you can sort of empower girls. And so that's really where the creation of the Girls Alliance began, is firstly with the Kiowa Trust, then with USAID. And USAID then asked us, we're going to give you this funding, but you're going to have to really engage private sector, bring in more money, and we're going to do a matching piece. And when we had sort of that challenge put to us, we said, okay, and it should be a local partner. And that's really when we reached out to the Paramount Foundation and said, we have a focus on health and empowerment from the Kiowa Trust. Is this something you'd really like to be a part of? And honestly, part of the reason that it was a real opportunity was adolescent girls was not a hot topic 3 years ago. And it might have been good timing on our part, but closing the circle 3 years ago was a real challenge. And so the opportunity that we posed both to USAID as well as the Paramount Foundation was, this is an underinvested group. If we invest in girls, it can transform the development sector and health outcomes if you're really focused on health. And that's the premise with which we started the Girls Alliance. And I'm just going to end on the challenge is that you have a private family foundation, you have USAID, which is a bilateral agency, and then you have a corporate foundation from the Paramount Foundation. So each of these three pieces, and we're in the middle. And that ability to be able to facilitate and bring together is the whole opportunity around the Girls Alliance. Is that too long? I'm done.
No, that's fine. That's fine. So let's talk about how it's worked. So can we talk a little bit about anybody talk a little bit about the results from the experience of the alliance?
So maybe I'll start, and I'll use the mic instead of this little pocket square. I think Neera was really kind of highlighting the challenges of collaboration, but also the benefits of really bringing together different partners. And even taking a step back, I think everyone knows USAID has been in India for decades, and doing very traditional type of development work, good work. But the landscape in India has really changed. The donor landscape especially has changed incredibly over the last several years, with a lot of the large bilateral donors withdrawing aid, with some of the multilaterals also cutting down funding. And so the idea is, with still such a huge need in India, how do we work with a credible local partner, a trusted partner like Dasra, to really bring in others, especially local indigenous Indian philanthropists, to start filling the gap? I think we all know with the CSR law, the Companies Act, there's a flood of resources coming in to India. And how do we, through Dasra and with the partnership, really identify a few platforms where we can bring people on? Because the challenges here are so big, they're so complex. And by bringing people together around a community of practice really helps us synergize, bring in kind of the talents that we all have. More than the resources, it's the ingenuity that the private sector brings in to really identify innovative, cutting-edge solutions and approaches to solving some of the greatest challenges. And I think, I don't need to go into the data and the evidence of what the adolescent girl in India faces. And while we come in with a strong health lens, the idea of just using health or sanitation to solve the challenges of an adolescent girl, you need more. You need to really look at that 360 view, and the idea of bringing people onto a platform while we're starting in phase 1 with us, the Piramal Foundation, Kiowa Trust. As you bring more people onto this platform, it only gets stronger to really help the adolescent girl.
Paresh, would you add to that?
Sure. Just as said, I think it's really a question of what Xerxes mentioned about it's not just funding, it's not just resources, it's much more than that. I think to go back to what Jonathan talked about, 1 plus 1 actually equals 11. So to me, the alliance is really a question of how do we make the whole more than the sum of the parts is my favorite term. And how do you make that happen? And I think that provides an excellent platform, as Niga mentioned, to really bring like-minded partners. I'm not just saying individuals, philanthropists, but partners, and they need not necessarily be funding partners. So one of our discussions in our steering committee meetings has been that yes, funding is important. I think Dasra has made a great kind of start to this alliance over the last 3 years in raising almost 90 crores plus. So I think that's a great start. But I think the multiple perspectives of building this ecosystem, which could be technology, which could be getting the government involved, which could be getting research and evidence around what is happening in the sector and so on and so forth. So bringing those multiple perspectives onto the discussion table and to make this happen, I think is one of the most powerful course changers, I could say, that can happen through an alliance like this. I think yesterday we had this day before at the Bombay Stock Exchange, this discussion, and there's a report out there on technology, ICT in health. Now, if you bring partners who bring in that core competency to making this sector more robust or making this whole attempt more robust, I think it will help us reach that objective faster, sooner rather than later. So I think that's I think the value that I see of this alliance. So it's not resources just in terms of funding, it's resources possibly of all kinds, and we'll possibly expand on that a little later.
Right. Well, what strikes me in your comments is that you're all approaching it from a slightly different angle, but getting what you want out of it. You have a very intentional path for what your specific organization wants. You want to build a platform. You want to serve as a hub. You want to make sure that one-on-one equals 11 or the whole is greater than the sum of the parts. I'm curious, it still feels sort of generally like collaborations are nice and easy and you're getting all the things you want out of a place or an institution or a platform like this. I'm wondering if you could reflect on sort of some of the things that have been difficult in the alliance to date. We don't want too much dirt, but enough so that...
I really love Xerxes and Paresh.
You don't really know how the steering committee meetings happen, do you? Neera, you going for it?
No, go ahead.
Okay. So absolutely right. I don't think partnerships are easy. Collaboration's never easy. We always talk about the nice things, but one of the things we have always tried to do in the Piramal Foundation, also in our own work, is we believe that partnerships are important. We believe that partnerships have to be open source. So it's not that I hold on to an IP as saying this is what I do and only I will do it, but I am happy to share that, and that's been our approach. And obviously when you talk about open source approaches to partnership, it's obviously never easy because every partner comes with a different perspective to that same issue or a different solution, as Rohini talked about. And how do you find, in a sense, the least common denominator, the convergence point, to really build on something that all of us believe in is so very important, but at the same so very difficult. And I think that to my mind is possibly, I wouldn't say compromise, but really finding that point of convergence where we believe that yes, this point of convergence can really create an impact on what we are trying to attack, I think you need to keep drilling it down, keep sharpening to the point where you come to that particular space.
maybe I'll just add, and I think, the collaboration for collaboration's sake is not worth it. And I think this is where you have to really look at these shared value partnerships and really understand, okay, what is in it for everybody. Sometimes I think, Paresh, you were saying the sum is greater than the good. It's really looking at, by bringing in the expertise of different organizations, by having kind of a common goal and a common vision, collaborating then becomes very strong. Because if you're just going to collaborate to be at the table, the more partners you have, the more voices you have, the harder it becomes to really identify a clean, clear vision. Because as part of even the Girls Alliance, the challenge has been, with many different partners having different focuses, how do you make sure with the resources available that you're able to do meaningful work and evidence-based work that shows good results? And you don't want to dilute the alliance to just a small group of different activities that are very disparate, because you have different partners that are having different types of objectives or goals. So you really want to be able to have that common vision that everybody is there to work towards.
Yeah, I absolutely agree. I think both with what Paresh and Xerxes have said. I think it's really important for all of us, especially when we're sitting around the table, that we're all aligned on what we're trying to achieve. What is the theory of change? And Xerxes pushes us a lot on this. And are we really keeping the impact that we're trying to achieve at the forefront of everything? So I would say that was probably, is extremely key. I think the second thing is it has to be strategic with each of us as our individual organizations and where we're coming from. And we talk about this a lot, that as we move to grow and bring in other partners, we're really going to need to think about what's the give and get, right? What are we going to give as a platform, and what are these folks coming in going to be able to get from it, is sort of what I would say is a second thing. I think the third thing is there has to be common measurement, and we all have to be held accountable for it. And so I think as a steering committee, when we meet regularly, we're being asked of each other, are we achieving what we set out? And really clear goals over the year. And so just drilling it down to outputs is very helpful, because we're all then keeping each other accountable. I have 5, so I'm on number 4. The fourth is facilitation. So I think when we just talk about collaboration, you need something, someone, an organization to be able to support the backbone of this collaborating effort or the facilitation. And there often isn't a willingness to pay for something like this. So unless it completely strategically aligns, which for most of us nonprofits, you really have to make it work, you need somebody to pay for it. And USAID actually stepped up and said, wait a second, we'll be willing to pay for the facilitation, you better make this work. And that's really where we've put ourselves as an intermediary, and I hope you reach and read the report that speaks to the need for sort of intermediaries. And I think the fifth thing is leaving your power and ego out the door. And we're little, that's right, fairly little. I mean, I'm short, but compared to like Xerxes from USAID and Paresh from the Piramal Foundation, I mean, they're kind of scary. And so I think, can be scary.
She calls her role to be facilitation.
Yeah, apparently diplomacy is not part of the facilitation. I've heard that Xerxes is huge. Is that what I heard, right? That's what I heard?
All of our egos need to be really left behind. And again, that sort of leave power and ego, let's all be equal here and really focus on what we're trying to achieve, I think is core to allowing all of this to succeed.
Right.
I think just to add to what Leena was saying, maybe a specific example. No? Maybe. A specific example of, I think, what we have gone through in the Alliance itself. So I think when USAID came down and said that we are willing to support this whole facilitation process, not too many foundations, philanthropists will support capacity, so to say, right? Capacity building at this level. I think the role that USAID took on was really, in that sense, I think very catalytic. And I'm saying catalytic because while they said we will help build this capacity or will help this facilitation, they also made it clear that we have to, so please treat this almost like seed capital resources, right? We didn't have the benefit of your guidance at that time, but
we had Sanjay who's here.
Sanjay is around, I think, yes. Sanjay is right there in the audience. So Sanjay, Sharmila were very much there. So I think bringing that as seed capital, but at the same time saying that we have to raise matching funding from local sources. I think that was so important.
So it's not just saying that we know it all, we know what it takes, but really saying that we will come in, provide support where maybe it's not available locally, but we have to have local resources who will match what we are putting in. I think that was a great approach to a partnership, I would say. And that really goes to the core of the USAID philosophy itself. Yeah.
Sure.
Yeah. So I just want to pretend I look like Lynn Smitham. So I look like nothing like her. But I think it's useful here to step in with her hat, which is, and Peter's hat, which is of a private philanthropist. And I think the role that they played was allowed us to actually take a bit of risk. So as much as, US aid could be labeled as seed, I think that there are certain constructs and expectations of a bilateral agency, which doesn't always give you the kind of flexibility, risk-taking, experimentation that often family philanthropy or individual philanthropy like the Kiowa Trust actually enables us to do. So I feel like the three at the table give you different kind of capital that's required and different kind of flexibility to achieve kind of where we're going.
That's really interesting. Actually, it's also striking to me, as you used the word capacity building, that we often in this room, at least today, we've been talking about capacity building at an individual organizational level. And yesterday at one of the events, we were talking about capacity building at the foundation level, the philanthropist level. But what you are all doing is capacity building at an ecosystem level. The Kiowa Trust emphasizing adolescent girls. You're talking about Arnhem and CH and plus A with a health focus. The way you are collaborating is about ecosystem building and capacity building in that regard. I'm wondering for the folks in the audience, do you feel like the Girls Alliance has provided, I wouldn't say the word template, but guidelines for other people to think about how you might build an ecosystem?
I mean, I definitely want to say yes. I think we need to document this process also. I'm hoping that that DASRA will do that, because I think the lessons learned will be really important. And I think this can be an opportunity for others to experiment with different types of ecosystems, and things are already happening in other spaces. I think the value of the Girls Alliance is also the seeing this grow and really looking at how do you bring in other partners. I think USAID is also very interested in DASRA, not just for the Adolescent Girl Alliance, but at the same time really having DASRA serve as that intermediary and trusted partner to really start engaging Indian philanthropists and Indian foundations, because that, I think, is going to be the game changer, if not already is, in India. I mean, understanding the situation on the ground, having the heads of your corporations who have so much clout to be able to influence and shape policy. And as the NGOs look to get other donor funding, I think the philanthropists play a large role in identifying who are the strong NGOs out there that are well deserving of money and that can actually achieve measurable results is huge. And the foundations, as they get stronger and really start to, for those that really want to engage with government at the national level or state level, have this really, really strong ability to shape the agenda and move the dialogue.
So I'm going to shift gears here for a moment and just talk a little bit about the research, because I think it dovetails nicely with some of the comments you made. And as I lay out the 5 things we've discovered, as Bridgescan discovered in supporting the Kiowa Trust and DASRA in particular, thinking about what else could be needed for adolescent girls, so just to reflect on that, and then I'll ask you to comment on what you think deserves prioritization. So we had the fortune as an organization of supporting some work to do some research on a very ambitious and almost too bold question, which is how to achieve more and better impact for adolescent girls in India's disadvantaged communities. And we did what folks in our suits and our seats typically do, which is looked at a lot of secondary research. We interviewed 60 leaders around the world and in India, practitioners on the ground as well as funders, intermediaries, and across a wide variety of research, came up with basically 5 themes. 5 themes that we believe need to be incorporated into any strategy that has massive impact on this really important and vulnerable population and a population with very, very high potential. And the first theme is addressing the norms for the girl. We've heard that in different forms through the morning. But the basic idea is that for outcomes for adolescent girls to change, the way they are treated and the way that society interacts with adolescent girls has to change at every level and in every dimension. The second theme has to do with evidence. This came up in this conversation. Where are there programs where are their policies, where are their approaches that are actually promising or proven to change the outcomes for adolescent girls. The theme of collaboration was an obvious point, and I think Xerxes raised it first on this panel, which is to suggest that adolescent girls are not students. Firstly, they're not victims, but they're not students, they're not daughters, they're not mothers, they're all of the above. They're a variety of different things, and they play different roles, and taking a holistic look at them through a lens of a convergent approach is really, really important, and the only way to think about that we discovered is through a collaborative platform. Government plays a pivotal role in India. India's very unlike other countries in the sense that there's an expectation almost unanimously that government is the scale partner of choice for evidence-based programs for policies that matter. And lastly, scale. Everybody knows the numbers, but no matter how successful individual NGOs are, if you look at the most successful, they tend to tackle 1%, 2%, 3% of the challenge underlying that they're trying to address, and the need to do this on a massive scale is really important. So norms for the girls, evidence, collaboration, government, and scale. I think we've hit the collaboration one quite a bit already. So as you think about the other themes that emerge from the research, none of them surprising, I'm sure. Are there, as you think about the next phase or the increasing emphasis of the work of the Alliance, are there any in particular you think that need to be addressed with urgency?
So I think two come to my mind, and again, we have talked about this within the Alliance quite a bit. One was, how does one engage with the government proactively? It's something that we believe also at the foundation, Piramal Foundation, very, very critical. Because I think a lot of what we talk about, whether it's maternal and child health, whether it's adolescent girls or any sector that we pick up, I think these are, all of us know that these are services or these are facilities that the government is supposed to empower its citizens with. But yes, there are challenges. There are challenges at the last mile especially. The government has the programs, has the funding. I think all of what we put in, and when we say we as in USAID, the foundations, the world multilaterals, everyone that puts in money today typically accounts for less than 1.5% of the government's, what the government spends. So what is it that we need, or what is it that we can do with governments with this kind of funding, which is so minuscule as compared to the government's resources, I think is a critical point. So I think many times, even in these rooms, we have heard that people have come up and said, how do you work with the government? The government wants to do A, B, C, and we are talking about X, Y, Z, and the two never match. I think, again, finding that point of convergence that is of interest to the government, and where I think as philanthropists, as foundations, we can bring value is something which is very critical. So the government engagement is important, but at the same time, I think we need to think very deeply about how that engagement can work and can succeed. The second one is evidence. I think more and more we are convinced that whatever we do, we have to be able to show outcomes, collect that evidence, collect the data. And something that we were speaking about yesterday, Rohit, is really bring out that evidence in the public domain. I think today, while I'm sure a lot of people in this room, again, look at evidence, look at outcomes, do impact assessments, how much of that really comes out? That's, I think, important. And it's not just a question, like you were saying in a different context earlier, not just talk about our successes, but also talk about our failures. We all try out multiple approaches in solving these issues. Some work, a lot don't. And I think it's as important to bring out those failures to say what didn't work. Because why reinvent the wheel? I mean, for me, when we talk about collaboration, when we talk about the ecosystem, it's all about saying, let's not reinvent the wheel, let's learn from each other, and how do we do that more effectively?
And maybe just adding to, I think that last point, Paresh, was really, really excellent in the sense of learning from each other. And how do you look at that community of practice? And even if we're not collaborating together, how are we at least sharing the information? Or is there a platform where we can have that information at our fingertips to learn, so we're not reinventing the wheel. Because in India, with such a large burden of disease, complicated issues, not doing the same thing over and over again in different districts, I think there's value to that. And I think this is the idea you brought up of scale. All of these fit in very well together. But the idea of scale is also a very important thing, because if you have a good group doing something in a block or a district, and they're doing really good work, how do you share that with others? How do you look at other foundations, not necessarily the government, to really try and define what scale means? Maybe scale means saturation in a district. Maybe it means in a state. We can define different metrics for scale. But also, as foundations become more sophisticated, your board members, your donors, your funders are going to want to see what are those evidence-based results that are out there, that we're not just giving money to touch lives per se, but what is the actual change that can be measured is going to be very important.
Yeah, so I think I just want to emphasize that as lovely as these 5 things are, and you know how Bridgespan or McKinsey or other consulting firms do this great job of giving you these boxes and saying, these 5 boxes are the elements that are going to really move the sector. I think the reality is you can't work in isolation in any of these boxes. And if you only do one without the other, it actually doesn't work. And so part of the attempt in our approach moving forward is, how do you invest in the right amount for each of these boxes to really come together? And the approach that we're proposing that we take for the next few years is really, let's look at what's on the ground, what's happening. And absolutely has to be organizations. Let's find the ones and the models that can really scale. Because if you can't achieve scale in this country, it's going to be a real challenge to really solve the problem. And so what we're proposing from Dasra's side with these 5 boxes is look at organizations, and it's a lot to do with just the philosophy that Dasra comes with, is look at organizations that have the potential to scale. Use this group to build evidence. It costs money to build evidence, and so you got to pay for systems, data, analysis, so you got to pay for that. Now, if we have a captive group, build evidence around it, invest in organizations that are also, looking at norm-changing work, collaborate amongst these groups, bring other stakeholders, and use this platform to engage with the government as well. And so I'm sure I've confused the whole thing, but it's really important that each of us realize how all this really needs to come together, is what I wanted to leave you guys with.
Great. So let's start it over to the room for Q&A. We have a few minutes for questions, if anyone has any questions.
Hi.
Could you introduce yourself and then ask the question? Oh,
There's Lauren.
Okay, sorry. Lauren Bradford Foundation Centre. I've just got a sort of broader policy question, which is, we're talking here about essentially gender issues, and at the same time we have USAID on the panel, and there's this current global framework, the Sustainable Development Goal framework. And so I'm wondering, as we talk about the need for measurement and indicators and collaboration and USAID implementing the SDGs, how we're tying this piece of work to Sustainable Development Goal 5, which is about gender equality and empowering women.
Yeah, I can start at least. So it's not that easy, and I don't know how many of the folks in here are even familiar with the Sustainable Development Goals. I think we're getting used to using it as a framework locally, and it's been a challenge to get organizations to connect with it. So I think we all want to move towards that. What has been really helpful in our engagement with Bridgespan, and also USAID and Paresh really asking us, what are you going to measure? What do we need to measure? I think there are 5 key indicators or metrics or pieces that we need to focus on, that there is evidence to say if you invest in these 5, it will empower adolescent girls. And I'm going to narrow down your gender question to very specifically sort of adolescent girls. One is decreasing the age of child marriage, keeping girls in secondary school, delaying first pregnancy, increasing self-esteem, and increasing self-efficacy, which is like agency and ability to make choice. So if you can focus on these 5 things, there is evidence to say that the full sector of girls, we would be able to say that with confidence that they're empowered. So we're trying to get there. I just need folks and organizations to invest in building a bit more evidence, but
Yeah.
No, just very quickly, I think the Sustainable Development Goals are countrywide, and I think USAID is definitely helping India reach those, and is one small partner in that goal. But I think everybody in this room really should be committed to India succeeding in meeting the multitude of the Sustainable Development Goals. And I think it really starts, I mean, I don't want to sound corny, but with everybody in this room really helping do their individual pieces around the gender piece, really looking at where do you invest, how do you come together, and how do you identify these game-changing interventions that really then can be aggregated up when the countries do their national statistics and surveys to be able to see that.
Another question back there.
Hi, my name is Raj Gilda from Lend a Hand, India. Absolutely agree about evidence-based, giving and collaboration and other things too. But, all the issues we are here after many years of, complications and other things too. And the solution or the evidence of it will not arise in 1 or 2 years in that sense. And as an NGO, the challenge we have always faced is that most of the funding you get is for, if you're lucky, 3 years. And if you're extremely lucky, 5 years, okay? But most of the time it is yearly renewal and other things too. So how do you, but at the same time it takes a lot of years to build the evidence, which is quantitative, attribution issues are not there and other things too. So how do you really, balance between the two, right? Need for evidence versus the time it takes to build the evidence and the availability of funding, at the same time.
Should I just do something quick?
No, I think absolutely valid question, Raj. There's no question about it. So I'll go back to, I think, a couple of points that you touched upon and our own experiences. We work in education, and we work with headmasters in government schools to improve leadership capacity. Now, the end objective of this hypothesis is that it should lead to improvement in learning levels for the students, because that's the end objective. We've been at it for about 8 years. After about 5 years, we started measuring the outcomes. And in the 5th year, when we started measuring this, no change. Control sample, treatment sample, baseline, end line, no change. And the team, we went back to the drawing board. But then last 2 years, we have seen that there's, on an average, an improvement of 20% in learning levels in grade 3, grade 5 in rural, urban, and metro schools, government schools, right? Now, I think if I use that example, it just tells us that yes, you have to be at it. There's no question about it. I think our team was lucky enough to have an anchor investor who said, yes, I believe what you're doing, was willing to take that risk. But I think that's where the role of philanthropists or family foundations can come in. Really to support some of these elements of the program that are so important when we talk about evidence, but that you would not normally get funding for from, let's say, CSR. I mean, CSR will find it very difficult to fund an evidence or an impact assessment component of your work. But can family foundation and philanthropists come in and support that, or can bilaterals or multilaterals come in and support that? So yes, it does take time. I think the funding model needs to change, or what Educate Girls went through. I'm using that as an example. I think the whole example of social impact bonds that Educate Girls kind of managed to raise, where you have someone who's actually tracking that, and there are investors who are willing to back that tracking over a 5 or a 6 or a 7 year period. I think some of those elements have to evolve. And the other issue I will touch upon is what you mentioned about attribution versus contribution. I think in healthcare, when we work, for instance, in maternal and child health, we are just one part of that ecosystem. So I can never claim that what we are doing is actually leading to a reduction in maternal mortality. We are contributing to making that happen. So I think it's very important to realize that everything can't be attributed to what we are doing. Somewhere we are just contributing to the larger ecosystem to shift the gears. But I think that realization is as important. You touched upon that yourself.
Can I just add one thing? So I think it's really important, and thank you for bringing up Educate Girls. It was actually our very first Thusra Giving Circle, and it's about 6 years, 7 years out, or maybe 5 years. And there's two things. One, it depends where you are at the stage of your organization. Please do not start building evidence when you haven't even, you still need that flexibility to figure out whether your program is working. And so there's an M&E piece, right? Do the M, do the monitoring and get your systems straight and use your data to make sure that you have the ability to change your decisions and figure out your programming. What I think is really important is do that at an organizational level. What this evidence box, in my mind, is build evidence for the sector. So we need to be able to raise money to get a group of you guys and gals to have strong systems and build data for the sector with the end point of what? To influence policy and to get the government to adopt it. So I think you have to think about it as two different pieces, and don't jump the gun, because I think the expectation of each of you to ask organizations to build evidence for just you is very inefficient. And so I think collaborating on the basis of how you measure together as a group, make it easier for the organization, then influence policy, is the suggestion we should have.
So we have time for, thank you for that, and we have time for one quick question and one quick answer.
Oh, yeah, here.
I'm sorry, I'll pass because it may not be a quick question and I may not get a quick answer.
Candor, we appreciate it.
I guess my question would be, what would be your recommendations for policymakers in the next phase or the next iteration to help DUSRA grow and or enable this ecosystem? As you said, it's part of a broader question of changing the lives of adolescent girls. So what do policymakers need to take from your work?
Maybe I'll start. And that is a complicated question, and I think it requires almost nuance, because especially when you're dealing with gender adolescent girls, we were speaking about this yesterday, you have so many different government ministries involved in this sphere. And so I think the idea for policy also is really looking at how does one identify different types of interventions, test them out, show the evidence that's there, to be able to advocate for the policymakers within your own ministry or your own sector. And depends, in India also with the decentralization or devolution of authority, you also have a lot of power at the state and district level to influence policy at multiple different levels. But I think the important piece is really saying, okay, how can the work you do not be done in isolation just to improve the quality of lives for people, which is very important, but at the same time, how do you try and use the experiences, use the knowledge to almost have a groundswell so policy is being changed, and work with those organizations that are really adept at it, using those nodal agencies that also have that access, identifying who has that access. And I think a lot of people in this room, humbly said, have a lot of that access to actually influence and shape policy here.
Yeah, and I'm going to just reverse moderate and ask Rohit to talk about one of the options that we came up with that you helped us, was the idea of creating a mission, whether at a state level, that actually helps convergence. And they've done this for, come on, tell, please.
We're out of time, and as somebody who likes to be on time, this is trying to get under my skin. No, it's fine. So just a basic idea to answer your question of policy is looking across the adolescent girls spectrum, I encourage you to talk to the NGO leaders in this room. You get a universal, almost universal set of feedback that the national level policies are actually pretty good. And in fact, more than pretty good, very, very good in some cases. And the challenge is, as Xerxes said, is in India's federal system that the state level decision makers and its makers, multiple ministries, multiple groups, portfolios at a chief minister level that have to negotiate to get something done. And there's almost a behavioral change expectation that has to be done at that level. So if you look at different ways social change has happened in India with some progress, so you look at the Maharashtra State Health and Nutrition Mission, which I think you and I talked about a little briefly yesterday, is a great example of one way in which people work across silos in a state government system to actually affect positive change that in this particular case also addresses adolescent girls. So going in mission mode at the national or state level seems to be one pathway to affect change, but it's not answering the policy question because the policy seems to be quite robust. It's actually implementation of the policy. And there are other modes in which India has very successfully stepped up to and addressed changes, which is really important to note that over the last couple of years, couple of decades, and they've done it through government policy frameworks. It's not all just doom and gloom. There's a lot of positive momentum. It's just about thinking about what you need to act on at the state levels and the local levels to make that happen. With that, let me say thank you to the panelists. I think we break.